So Ray, what are you seeing at the ATA show that gets you excited about telehealth in 2013 and beyond? What are some new interesting trends that you see?
Well, one of the things that I'm seeing is a greater interest from the audiences here at ATA in trying to understand how to utilize telehealth solutions, right? Telehealth has been around for a while. We're seeing a greater segmentation of solutions within the telehealth environment, from telecare to telehealth for chronic conditions to telemedicine via video. So I think the excitement here at ATA is really what is getting us to understand where telehealth will play in different deployments. And that's really exciting news for the industry. People are beginning to look at how do we take cost out of the equation? How do we really deliver improved quality of care for patients or members with chronic conditions? And at the end of the day, we have to work toward being more accountable in the care delivery, and telehealth is here to help us do that.
What about beyond the show itself, in the industry generally? What are some of the trends and new and exciting developments that you anticipate?
Well, there's great technology innovation happening here, and we're seeing a lot of it at ATA, from remote ECG devices that can link from a Bluetooth device into a back-end system. So we're now, the shrinkage of the technology is helping us get more data. But getting the data alone isn't what is going to help control a population. You've really got to build through a clinical workflow to help drive behavior change, right? And that's really where we see the technology and the integration of the clinical services coming together.
What are your customers in particular looking for when they begin to implement telehealth?
That's a great question. When folks get started with telehealth at the highest level, they think, well, let's get the telehealth devices in the homes, and we're going to get started and everything's going to be great. What they don't realize is that they've really got to drive an understanding of what is the problem they're trying to solve. If we don't understand the problem we're trying to solve, then deploying a technology is not going to help. So what we do is we work with our customers to really help them understand their population assessment, help them understand how they're going to be able to integrate remote patient monitoring into the clinical workflow, into the IT workflow, into the operational workflow. They have to think through the privacy and security issues. So we look to help our customers really define the blueprint for a successful remote care management program, then think about which technology they need to use. And we help them understand that. We provide those levels of service to say, let's work through the population, let's work through the implementation of it, then let's deploy the technology. Because at the end of the day, with telehealth and remote care management, it's about the people in the workflow, it's not about the technology.
One of the most challenging things for a lot of providers is getting started. I mean, how do you determine what you need, and how do you go from the point of that to actually beginning to start? And how do you guide clients in determining first what they need and then transitioning into actual implementation and starting?
Well, we guide our clients to say, look, you don't have to do it alone. Find folks that have done this before, look for best practices and key learnings from other organizations that have deployed successful remote care management programs. And then we help actually coach our customers with a 4-phased implementation for remote care management. We start with assessing the environment and help them really learn about the problem they're solving, the populations that they're working through, what clinical resources they're going to need to be successful. Then we help them plan it, which was the blueprint that really helps them get from here to there in the implementation of it. And then we go through the deployment process with them, because as you deploy new technologies, especially for patients in the home, you have to get them familiar and comfortable with utilizing the technology in order for it to be most effective for the long term. And then finally, evaluating your plan over time, ensuring that you can really drive the program forward, adjust it as you need to, because you will, and then ramp it for scale. And one of the exciting things that we're seeing here is people are looking at moving beyond the pilot. And that's good news for the industry, because if you do a 20 unit or a 20 patient pilot, you're really not going to see the long-term results, nor are you going to see a return on your investment. So our advice to our customers is think scale, think 500, 1,000, 5,000 patients moving into a remote care delivery model. Move the cost out of the brick and mortar, move it out to the home, deliver greater efficiencies from a clinical perspective as well.
You mentioned ROI and determining that. Is that something that providers are concerned about first and foremost? How do you in telehealth, how do you determine that for different providers?
That's a great question, because what we see with our customers, they often get right to the point. How much does it cost per patient per month, right? And they bottom line it to the per patient per month. And that's an understandable methodology if you're thinking traditional reimbursement, right? But when you start thinking about behavior change that keeps people out of the hospitals, you really have to look at a 3-year total cost of ownership and evaluate your return based on your population size over a 3-year horizon. So you're normally going to have a higher dollar cost up front in year 1. But as you continue the program in year 2, 3, and beyond, your cost per patient begins to drop dramatically. So we advise our customers to think long term, think in a 3-year return on investment. I believe that if they're going after a post-discharge program to reduce hospital readmissions, they'll see that return much sooner, because we know that those readmissions are costing them a lot of money. So start with the problem you're trying to solve. If it's readmissions, work toward that goal. If it's improving quality of care and quality metrics, work toward that goal and build your program around it. But ROI will be related to the problem that you're trying to solve and the total cost of your solution with both the external resources and your internal headcount requirements.
Yeah, it seems like in the industry now that connection between quality and cost is really becoming clear to providers, and it sounds like you really can stress that.
It's becoming very clear to providers, and it was interesting. There was a hesitation when they learned that there was going to be penalties for hospital readmissions, right? They kicked in last October. They're going to kick in at a higher rate. Now they're looking at it not necessarily from the cost of that particular care for that patient, but what is that longer term? If I can prevent hospital readmissions over a period of time for my patients with CHF, COPD, or diabetes, you're talking big savings in the long term. The other interesting aspect of this is it's the at-risk organizations that are really seeing value in telehealth. So Medicare Advantage payers, for example, they recognize that they have a capitated payment for their audience. So they want to make sure that they deliver a model of care or multiple models of care that will enable them to deliver the right care at the right time at the right cost. And that's where telehealth can come in and help support that. The other motivators for them are they recognize that CMS will pay bonus payments for high star ratings. So if you have a 5-star rating that's 3 or 4 or 5, you get a higher share of those bonus payments. CMS paid out $3.1 billion to Medicare Advantage payer health plans in 2012. That's a good motivation for implementing programs that are going to help engage the patients, engage the members, and get them in control of their own chronic condition.
At the beginning of our discussion, you mentioned that telehealth is about more than simply the technology. How much of your role, Care Innovations' role, is education and training beyond just the technology?
I see that as our responsibility, right? We really have to educate the audiences on right-sizing a remote care management program for their objectives. We recently launched the Remote Care Briefing Center in collaboration with Healthcare Payer News. And the whole objective of that environment is to educate the audiences on getting started. What are the key considerations when deploying remote care management? How do you evaluate your cost structures and both on the cost and the reward side? And really try to bring out an awareness so that folks can understand, look, this isn't as hard as I thought. I can get started. I can start deploying in volume and scale, and that's where I'm going to be. It's going to be the most beneficial for those audiences.
You mentioned the payers. You're seeing a lot of private commercial payers really kind of driving the push toward telehealth?
Oh, absolutely. Especially in the Medicare Advantage space. There's about 20 Medicare Advantage health plans that cover about 85% of the 14 million lives that are covered through Medicare Advantage, right? And they recognize that they've got to have a spectrum of solutions for those patients with chronic conditions. They've got to have telephonic outreach. They've got to have some automated voice response for lower level conditions. But when it comes to clinically driven remote care management, they really need to think through that clinical workflow. They need to think through how those programs can integrate with their other programs and really look toward a vision of a more holistic care for that member to help engage that member and help keep that member on to their plan versus another plan.
Looking ahead 1 year to the ATA conference in 2014, is there any particular topic that you think the industry will be talking about 1 year from now?
I absolutely do. I think the vision for the industry is going to be moving away from this device-centric approach, right? You put this telehealth device in the home, you connect it up, you put the peripherals attached to it, and everything's going to be solved. I think we have to think out of the box. We have to think disruptive as an industry. We've got to, take a step forward to the point where we're uncomfortable and step 2 steps more, right? We've got to get to scale, and I think that there's going to be a convergence of care that's going to happen in our industry to really look at chronic conditions that's delivered between the care recipient and the clinicians, but moving on to how do informal caregivers play? What role do they play in the delivery of care? What role do private duty caregivers play? How do we bring them together in a spectrum so that everybody is aware of what's going on with that patient? And how do we ensure that there's communication and awareness among and between the care teams? Because if we can do that and rely on some of the growth in the population and family and informal caregivers, then we get to tap a resource that can help drive adherence to care plans, help drive adherence to meds for aging parents. These are things that when we work together toward a vision of a converged care model, that we're going to see some exciting new solutions.